Hi everyone, I'm Dr. Sandra. Today let's talk about dandruff. Now dandruff is something which all of us must have suffered at some point in our life. We must have used multiple treatment and shampoos to treat dandruff, but it's something which is very normal and it can be controlled. It's not life-threatening, and with the right amount of tips it can be cleared. Now today let's talk a little bit about dandruff, about what it is and why we get it and who gets it, and certain tips and treatment to prevent dandruff. In medical terms, dandruff is also known as seborrheic dermatitis. Now this is seen as itchiness over the scalp or these greasy, scaly lesions, which can also be red scales seen over areas where there is large amount of hair or wherever hair is present. That is over the scalp, over the eyebrows, the sides of the nose, and even inside your ears or behind your ears. And in men, it's also seen over the chest and over the back. Dandruff is seen in almost in every ethnicities. Anyone can get dandruff. Second, it's most commonly seen in men more than women. This is maybe related to the hormones. Third, it's commonly seen in all age groups, but mostly during puberty or during adolescent age group because of increase in hormone production, which leads to more oil production from the oil gland, which leads to more dandruff. And dandruff is also seen in babies. Babies can also present with seborrheic dermatitis or dandruff, which is seen as cradle cap, which is seen over the scalp. Seborrheic dermatitis or dandruff is a chronic condition. It comes and it goes. There is no specific treatment like a single cream or a magic pill to make sure that it completely goes away and never comes back. Now regarding the cause of dandruff, there have been a lot of theories and studies, but no one knows exactly the right cause or the exact cause of dandruff. Some studies say it's because of a fungus which is present in the skin. This fungus is known as malassezia. Some people are more sensitive to this fungus, hence it can lead to more greasiness, more flakiness, hence more production of dandruff. Second, it could be related to genetics. If your parents have oily skin or dry skin, there's a high chance that you might develop the same. Third, it could be related to the environment which you live in. If you live in a very humid environment or a very dry climate, then there's a high chance this could be a contributing factor. Next, it could be related to stress. Stress can cause a trigger or a flare-up of your dandruff. Certain conditions, skin conditions like psoriasis, eczema, or certain fungal infection of your scalp like tinea capitis, they are more prone to develop dandruff. Apart from that, certain other neurological conditions like Parkinsonism and HIV or AIDS, there's a high chance of developing dandruff. Lastly, even diet could be a contributing factor. If you consume a lot of dairy or milk products or processed sugars or processed food, this could lead to a trigger or a flare of dandruff. Because we think dandruff is caused by a fungus, most of the over-the-counter medications, antifungal shampoos helps in targeting the fungus or the yeast. The next time when you buy an antifungal medicated shampoos, make sure that it contains either of these contents: ketoconazole, zinc pyrithione, cyclopyroxalulamine, selenium sulfide, coal tar, or salicylic acid. These antifungal shampoos help in reducing the flakiness and the itchiness of the scalp, and they help in exfoliating the scalp. In certain situations, we also use topical steroid to bring down the inflammation. We use it only for a short period of time to control the flare. One of the most common problem or the most common mistake is that people believe that the antifungal shampoo is not working for them. This is because you might not be using it properly. You should always remember that you are not treating your hair, but you're treating your scalp. When you're using an antifungal shampoo, make sure that you massage it onto your scalp. Let it sit for 5 minutes. Let it soak into that area, and it helps to target that yeast or the fungus. The most important thing is that if you have an oily scalp or dandruff, you need to wash your hair more often. Now this doesn't mean it will dry out your scalp or increase the flakiness of your scalp. In fact, it will reduce the oil which is secreted by the oil glands, which ultimately leads to or creates this flakiness or scaling of the scalp, which is dandruff. So in general, if you have an oily scalp or if you have more dandruff, you need to wash your hair more often, so lesser the dandruff. Now this doesn't mean that you need to wash your hair at least 3 or 4 times in a day. Once a day or once in every alternate day is more than enough. There are a lot of myths related to dandruff or seborrheic dermatitis. People believe that it is because of poor hygiene. Now this is completely wrong. Like I said earlier, there's a lot of factors related to the cause of dandruff. It could be genetics, it could be stress, it could be diet. There's so many factors. Second, people believe that dandruff can lead to hair fall. Now this is completely wrong. Seborrheic dermatitis or dandruff does not Third is that dandruff or seborrheic dermatitis is contagious. Now, this is completely wrong. Dandruff is non-contagious and it will not spread from one person to another. If you find this video useful and if you have any doubts or queries, please leave a comment below. Thank you.